Civilian nurses with that look never last a week. $200 says she quits by Friday. That is what Dr. Caldwell announced to the night shift, his voice carrying across the nursing station with the casual cruelty of someone who'd never faced consequences. 16 minutes later, he would be standing over the bed of a dying Special Forces major. He had no idea that the new nurse charting vitals with methodical precision at Station 3 had pulled that same major from a collapsed schoolhouse in Marja 20 years ago. Cedar Creek Medical's emergency department smells of antiseptic and floor wax, the fluorescent lights overhead humming at a frequency that makes your teeth ache after 8 hours. Danielle Ross has been working these shifts for 3 weeks, moving through the corridors like water, present but unremarkable. Her hands are steady. Her voice is soft. Nobody looks twice at her. The night shift supervisor, Patricia Chen, laughed at Caldwell's bet, but it was nervous laughter. Everyone knew what he meant by that look, the kind worn by women who didn't perform nervousness convincingly enough, who didn't flutter or apologize excessively, who made eye contact like it wasn't a threat. Patricia glanced at Danielle. Danielle was charting a patient's noon vitals, her pen moving with precision, and she didn't look up. The jaw clench was so subtle that only someone trained to read micro-expressions would have caught it. 3 weeks into Cedar Creek, Danielle had learned that Dr. Caldwell's control over the emergency department was absolute. He ran it like a kingdom he'd personally conquered. The residents deferred to him instantly. The nursing staff brought him coffee without being asked. The orderlies moved faster when he was watching. His authority wasn't written in policy manuals. It was written in the way people's shoulders tensed when he entered a room. Danielle understood the architecture of his dominance immediately. Fear was the load-bearing wall. He maintained it through public humiliations, strategic complaints filed with hospital administration, and connections with board members who owed him favors. His white coat was always immaculate. His voice carried the tone of someone who'd never been told no and couldn't imagine it was possible. The night shift gossip had started as soon as she was introduced 3 weeks ago, not malicious, just the ambient anxiety that settled over people who worked in his domain. The new attending physician, Dr. Pierce, had pulled her aside on day 2 and warned her not to challenge the established hierarchy. Patricia had been kinder. Just let him be right, even when he's wrong, she'd said. Danielle had nodded and moved on. What they didn't know was that she'd spent the last 18 years in environments where the hierarchy was measured in rank structure and combat experience. A physician with territorial neuroses was novel, not threatening. At 18:43 hours, the notification came through the secure tablet in her locker, the one she'd hidden beneath her spare scrubs, the one with the encrypted Pentagon direct line. The tablet showed her the transfer alert: Major Marcus Webb, Special Forces, inbound from Ramstein Air Base Medical, critical condition, incomplete medical records, flagged for protocol review. The message was accompanied by a classified file jacket with her operational parameters. Danielle was supposed to observe the Major's treatment progression and identify which personnel had access to his compromised records. Someone in Cedar Creek's medical system was altering veteran files, documentation of their actual injuries being replaced with generic combat-related diagnoses that masked something else entirely. The Major was the trigger that would flush out whoever was tampering with those records. She was the hook. Danielle sat alone in the break room for exactly 4 minutes, the tablet glowing in her hands, and read through the Major's file. Blast trauma from an IED in Helmand Province, 13 months ago. Partial hearing loss in left ear. Classified combat-related injury to the right shoulder that the official records described only as soft tissue damage. 3 surgical interventions in Germany. Discharged to Cedar Creek Medical for observation and supportive care. The classified addendum was brief. The Major's actual injury pattern suggested he'd been exposed to something beyond standard combat ordnance. Chemical exposure? Radiation? The military wouldn't specify. Just monitor medical staff access patterns. Identify who's covering what up. Danielle had been inserted into Cedar Creek Medical with a fabricated nursing license 3 weeks ago specifically to be here when the Major arrived. Her real credentials: Master Chief Petty Officer, 18 years active duty, combat medic certification, 3 theater tours, were locked in a Pentagon database under a name that didn't exist anymore. As far as Cedar Creek knew, Danielle Ross was a civilian nurse who'd worked at 2 other hospitals in the southeast. References checked out. Background came back clean. She was invisible. The break room door opened. Patricia stuck her head in. "He's here. Major Webb. Incoming through Trauma Bay 2. Caldwell's already in the corridor waiting to assess." Danielle closed the tablet, palmed it into her locker, and stood. "Thank you." As she walked toward the ER, her hands were steady. Her breathing was controlled. But her heart was operating at a speed that would have concerned a cardiologist. The major was the mission. Finding out who was tampering with his records was the operation. The last time Danielle had seen Marcus Webb, he was 8 years old, covered in concrete dust, holding a tarnished challenge coin in his small fist, the coin that a Marine had given him in the rubble of that schoolhouse in Marja. He'd pressed it into her hands before the evacuation helicopters arrived. "For luck," he'd said in English that was already accented with the drawl of a child raised between 2 worlds. "So you come back." She had come back. 3 more tours after that. And somehow, impossibly, so had he. The trauma bay was organized chaos, the kind that happened when a critical patient arrived without warning. Orderlies were positioning the stretcher. A respiratory technician was checking the ventilator lines. 2 nurses were establishing for access while a resident called out vitals that sounded progressively worse. The monitors showed a heart rhythm that was too fast and too irregular. The major's skin had the grey pallor of someone who'd been barely hanging on for longer than the body wanted to. Dr. Caldwell stood in the doorway, surveying the scene like a general inspecting troops. His presence made the air pressure change, the way it does when a large predator enters a room. Everyone moved faster. The resident stopped mid-sentence to wait for his input. The nurses looked toward him instead of toward each other, as if his acknowledgement was what made them real. "Who's the attending on trauma today?" Caldwell asked, his voice smooth and absolute. "That would be you, Doctor," Patricia said. Caldwell nodded once, slow and deliberate. He stepped into the trauma bay and looked down at Major Webb. The major was unconscious, monitors beeping out a rhythm that told everyone in the room this was a man who'd already died once and clawed his way back. Danielle moved to the foot of the stretcher, positioning herself where she could monitor the 4 lines and watch the monitors simultaneously. This was her job. This was what she did. The MacGuffin was still in her locker, the tarnished challenge coin, worn smooth by 20 years of carrying it. The challenge coin that Marcus Webb had handed her in the rubble, the same one that had just arrived with the major's personal effects. Caldwell read the transfer notes aloud, his voice carrying the tone of someone who was already finding fault. Incomplete documentation. Unclear etiology. No clear treatment protocol. He looked at Patricia. "I'll need the full classified file from Germany. And someone needs to explain why this patient came to us with records this compromised." "I'll pull the full file from Ramstein," Danielle said quietly. Caldwell looked at her for the first time since entering the trauma bay. His expression cycled through recognition, mild amusement, and dismissal in approximately 2 seconds. "You're new." 3 weeks, Danielle said. "Then you probably shouldn't be handling classified military records," he said, not unkindly. "Just factually." As if he were explaining something obvious to a child. "Patricia, assign this to someone with security clearance. And get me the major's labs from the transfer. Let's see what we're actually dealing with." Danielle stepped back, her face revealing nothing, though something hot and sharp was moving through her chest. This was familiar territory, the kind of dismissal she'd learned to absorb 20 years ago, the kind that came from the assumption that someone who looked like her couldn't possibly contain anything worth listening to. 3 weeks of it at Cedar Creek. 18 years of it in uniform, watching men with less experience get promoted because they looked right and talked right and fit the architecture of the institution. But the major was still on the stretcher. The monitors were still beeping out their irregular rhythm. And Danielle had just pulled an 8-year-old child from a collapsed schoolhouse while bullets were still hitting the walls. She had no idea what was about to happen. What she did know was that her hands had held lives together in worse conditions than this. And if nobody else in this room understood what they were actually looking at, she would figure it out anyway. The ventilator wheezed its mechanical rhythm as the Major's chest rose and fell. The heart monitor beeped once. Twice. 3 times. Steady enough for now. Danielle moved to the medication station and began preparing the access lines, her training operating on a frequency that had nothing to do with what Dr. Caldwell thought was possible. The medication station hummed with a soft beep of an 4 pump when Dr. Caldwell gathered the night shift at 20-30 hours. Danielle stood 3 feet away, finishing a medication count, when his voice cut through the fluorescent-lit quiet like a blade through silk. This is Danielle Ross, our newest nurse. He gestured toward her with the kind of dismissive wave you'd give to a piece of furniture. I'm taking bets, $200 says she quits within a week. Civilian nurses with that look never last. They think they're tough until they see real medicine. The residents exchanged glances. One of them laughed nervously. Danielle's jaw tightened imperceptibly, a single muscle contraction that would have gone unnoticed by anyone not trained to read human tells. She returned to her charting, her pen moving in steady, measured lines across the page. No tremor. No rush. Just the methodical documentation of her predecessor's mistakes. Dr. Caldwell waited, watching her face, searching for the crack that should have appeared. The flinch. The flush. The wounded silence. He found nothing. She turned the page and kept writing, her composure like a closed door. His disappointment flickered across his face before he turned away. At 2,200 hours, the cafeteria lights glowed against the Atlanta darkness outside. Danielle carried a plastic tray, sandwich wrapped in cellophane, a red apple, a small container of black coffee that smelled like burnt rubber and regret. She moved toward a corner table, the kind of isolated spot where she could observe without being observed. Her hands were steady. Her breathing was normal. She was already 3 weeks into Cedar Creek Medical, already measuring the architecture of its hierarchy, already noting which staff members deferred to Caldwell and which ones merely tolerated him. Dr. Caldwell approached from her left side. She heard him coming, footsteps that landed just hard enough to announce his presence. It wasn't stealth. It was dominance. His elbow connected with the side of her tray with the casual precision of someone who had done this before, many times, to many people. The tray tilted. The sandwich slid. The coffee cup toppled, and liquid spread across the tile like a warning. Oops, he said, and his smile had no kindness in it. Sweetheart, you should be more careful. He didn't look back. He didn't wait for a response. He simply walked away, already assured of his victory. Danielle kneeled slowly, her movements controlled. She collected each item, the sandwich, now darkened with coffee, the apple that had rolled for feet from the tray, the paper napkins that were already absorbing the spreading liquid. She wiped the floor in methodical passes, her knuckles white around the plastic tray but her face revealing nothing. A resident watched from 2 tables away. A nurse's aide looked uncomfortable and turned her attention back to her food. Nobody offered to help. Nobody spoke. This was the law of Cedar Creek's night shift: you either had power or you didn't, and helping someone without power only marked you as weak. When she was finished, Danielle disposed of the refuse in a trash bin near the exit. She did not replace her tray. She did not get more coffee. She simply walked back to the 5th floor, her scrubs still carrying the ghost of spilled liquid, and returned to work. At 0100 hours, during rounds in the ICU, Dr. Caldwell dropped a patient file at her feet. It fell flat with a sound like a playing card hitting concrete. The resident physicians watched. Pick that up, sweetheart. Or is bending over too much for you? One of the residents laughed, that same nervous laugh from the nursing station. A younger one, barely a year out of medical school, still learning which cruelties were acceptable in the hierarchy. Danielle stooped, her movements economical. She retrieved the chart, straightened, and met Dr. Caldwell's eyes directly for exactly 3 seconds. Her gaze did not waver. It did not ask permission. It did not seek his approval. It simply observed him with the kind of clinical detachment you might give to a pathology specimen under magnification. Then she turned back to her station and continued her work. His jaw clenched. He'd expected something, a cracked voice, perhaps. A glassiness to her eyes. He'd gotten nothing. 5 minutes later, alone in the supply closet inventorying 4 bags, Danielle's breathing finally changed. Not panic. Not fear. Control being released, just slightly, just enough to let the pressure escape. She gripped the metal shelf in front of her, the one holding boxes of 14-gauge angiocath needles and bags of normal saline, and her fingers left small dents in the aluminum. 5 distinct marks from her hand. The metal was cold. The pressure was deliberate. The marks would remain there long after she left Cedar Creek Medical, a physical record of every insult, every humiliation, every calculated move in Dr. Caldwell's campaign to break her. Her breathing steadied. Her hands released the shelf. When she emerged back into the hallway, her face was composed again, the submissive civilian nurse, grateful for the opportunity, undeterred by the obstacles. She passed a tech who didn't make eye contact. She passed 2 residents who were still laughing about the file on the floor. But that wasn't the worst part. At 01 for 5 hours, Danielle checked on Major Marcus Webb in the trauma ICU. His vitals were displayed across the monitor with the kind of clinical clarity that separated the living from the dying. Oxygen saturation dropping had been 94 at 2,300 hours, now 88. Cardiac rhythm growing irregular, a subtle arrhythmia that suggested sepsis or cardiac injury or something darker that Dr. Caldwell had already decided was untreatable. His color had shifted from pink to gray. His breathing had become labored, each inhalation a small fight. Danielle examined his chart. The orders were sparse, comfort care only. Pain management. No interventions. No antibiotics. No cardiac support. She paged Dr. Caldwell. He arrived at 0200 hours with visible irritation, as if answering pages from junior nurses was beneath him, as if the patient deteriorating in front of them was a personal inconvenience. His voice carried the same dismissive tone he'd used in the cafeteria. What is it? Major Webb's SATs are dropping. 88% on high-flow oxygen. Rhythms becoming irregular. I think we need to consider escalation of care. Dr. Caldwell looked at the monitor for approximately 4 seconds. Unsalvageable. Sepsis, organ failure, combat injuries we can't reverse. We keep him comfortable. Nothing else. The experimental protocol from Walter Reed might. Sweetheart, do you have a medical degree I don't know about? His smile was a weapon. Or are you just one more civilian playing dress-up in scrubs? Danielle did not respond. She simply nodded once and returned to her documentation. After he left, she waited exactly 90 seconds. Then she pulled her phone from her locker, not the hospital phone, not the one they could track, and she accessed the classified files through a private encrypted server. Major Webb's medical records existed in 2 places. The official Cedar Creek versions that any doctor could see, and the classified versions maintained by JSOC, by Special Operations Command, by the agencies that protected their own. The discrepancies emerged immediately. Medication dosages that didn't match combat hospital logs from Kandahar airfield. Treatment timelines that contained gaps, missing days of hospitalization, critical information redacted. Allergy information had been removed entirely, information that was present in the military records but absent from Cedar Creek's system. Someone had systematically altered these records. Someone with access to both the hospital system and enough authority that nobody questioned their changes. She photographed 3 pages of Webb's chart with her phone, the small flash of light reflecting off the metal shelves around her, and she transmitted them to her handler using a secure channel that existed nowhere in the official communication networks. The reply came in 60 seconds, pattern confirmed. Need positive ID on source. Maintain cover. Danielle understood what that meant. Her investigation and Webb's life were now on a collision course. If she challenged Dr. Caldwell's orders, her cover unraveled. If she didn't, the child she'd saved in Marja 20 years ago, the 8-year-old who had handed her a tarnished military challenge coin with shaking fingers while bombs fell around them, would die as an adult, unmarked and unresolved. At 0230 hours, she discovered that Dr. Caldwell had written a new note in Webb's chart, DNR, family request. Patient to receive comfort care only. No resuscitation efforts. Webb had no family in Atlanta. His emergency contact was a colonel at Fort Stewart who was classified. His medical decisions were governed by military protocol, not civilian hospital authority. Danielle stood at the nursing station, staring at those 5 words, understanding that everything she'd endured in the cafeteria, everything she'd accepted silently in the halls, had been preparation for this moment. The hum of the fluorescent light seemed suddenly loud, almost hostile. A resident passed nearby. A nurse's aide was charting vitals. The night shift moved around her like normal, like everything was routine, like a man wasn't dying from systematic neglect in the ICU for floors above. The mask she was wearing fit perfectly. Nobody could see what was underneath. But Dr. Caldwell's days at Cedar Creek Medical were about to end. The monitor screamed at 02 for 5 hours. Ventricular fibrillation. 3 sharp beeps that cut through the quiet ward like alarms announcing the end of everything. Major Marcus Webb's cardiac rhythm had dissolved into chaos, his heart no longer pumping blood but trembling uselessly inside his chest. The EKG strip painted jagged mountains across the screen, each spike a cry for help that no medication could answer. Danielle was 3 rooms away when the overhead intercom crackled, Code Blue, Trauma Bay 2. Code Blue, Trauma Bay 2. She was moving before the second announcement finished. Her legs carried her down the corridor with the fluid precision of muscle memory, years of combat field hospitals in her bones. The hallway blurred, fluorescent lights flickering overhead, the distant hiss of ventilators keeping other patients breathing, the smell of antiseptic so thick it burned her sinuses. Danielle's hands were already pulling on latex gloves as she entered the room, her voice steady and clear, cutting through the chaos like a scalpel. I have the code. Activate the crash cart. Get me a 14-gauge angiocath and 2 units of ONEG on the rapid infuser. Now. The night shift nurses moved with the synchronized precision of a team that had rehearsed this dance 1,000 times. One began chest compressions, pushing hard and fast on Webb's sternum at 120 compressions per minute, the rhythm of survival. Another inserted the fall line with practiced efficiency. A third prepared the defibrillation pads, the adhesive backing releasing a faint chemical smell. The room transformed into controlled urgency, each person moving to their assigned place, each movement calculated and essential. Danielle positioned herself at the head of the bed, assessing Webb's airway, her eyes reading his throat anatomy like a map she'd memorized in 100 emergency rooms before this one. The ventilator hissed to life, delivering 100% oxygen into Webb's lungs. Push, 1 milligram of epinephrine. Wait. Reassess. The monitor still showed that lethal fibrillation, electricity misfiring uselessly. The defibrillator pads were placed on his chest, adhesive sticking to skin, creating a path for the electrical charge that might reset his heart. Everyone clear, Danielle called, and the room fell silent except for the ventilator's mechanical breathing. The defibrillator discharged with a sound like thunder trapped in a machine, Webb's body jerking upward as 200 joules of electricity tried to reorganize the chaos in his chest. The monitors showed nothing but flatline for a long moment, then rhythm. Weak, irregular, but rhythm. The compressions continued. 80 seconds. 200 compressions. Another round of epinephrine. Another defibrillation attempt. The numbers were escalating, doses increasing, energy levels rising, the clinical desperation of a body refusing to stay dead. Danielle's hands moved with the certainty of someone who had done this in forward operating bases while mortars landed nearby, who had held beating hearts in her palms while sandstorms blew across desert landing zones, who understood that bodies were machines and machines could be restarted if you pressed the right buttons in the right order at the right time. The crash cart wheels squeaked as someone repositioned it closer to the bed. The rhythm on the monitor began to stabilize, climbing from dangerous fibrillation toward something more organized. "Pulse check," Danielle said, and the compressions paused. Her fingers found the carotid artery in Webb's neck, that small space between muscle and bone where the jugular ran close to the skin. She counted silently, waiting, feeling for the electric pulse that meant blood was moving, oxygen was traveling to his brain, the machine was working again. A beat. Another. Steady. "We have return of spontaneous circulation," Danielle announced, her voice controlled and clinical. The room exhaled, not with relief yet, but with the qualified hope that came from winning a battle but not the war. Webb was alive. His heart was beating. But he was still vulnerable, still critical, still not out of danger. The team continued monitoring, continued administering medications, continued the work that kept a body moving when the body wanted to quit. That was when Dr. Caldwell arrived. He pushed through the trauma bay doors 90 seconds after Danielle had called the code, moving with the authority of someone who expected the room to rearrange itself around him. His presence altered the air pressure like a storm system moving inland, his jaw clenched, his eyes moving across the monitors with the intensity of a predator assessing prey. He walked to the crash cart, picked up Webb's chart with a deliberate slowness that suggested he was about to make a pronouncement that would cost someone their career. "Stop compressions," Dr. Caldwell said. The room didn't freeze, it was already moving with purpose, but his words landed like a physical weight. "Stop compressions. Check the chart. DNR order. Family requested comfort care only." Danielle's hands, which had been adjusting the ventilator settings, paused but did not stop the chest compressions being performed by the respiratory therapist. Her voice came out level, measured, the voice of someone reporting facts rather than arguing. "Sir, there's no family documentation. No signed form in the chart. The only notation is a verbal consultation that's not been formalized." Dr. Caldwell's face darkened like a storm building over the Atlantic. His jaw tightened until the muscle beneath his skin was visible, a thin line of rage that he was working very hard to control. "I spoke with his sister yesterday. The family requested comfort care. That's a direct order. Stop compressions. That patient is unsalvageable." The other nurses froze. Actually froze, their hands stopped moving, their eyes dropped, their bodies' language shifted into the posture of people who had learned that contradicting Dr. Caldwell came with consequences that appeared in performance reviews and influenced decisions about scheduling and professional opportunities. The room held its breath. The ventilator continued its mechanical rhythm, indifferent to the human drama unfolding around it. Danielle's hands remained on Webb's chest. She could feel the compression cycles beneath her palms, could feel the machine doing what machines did, pushing blood, keeping neurons alive, buying time for miracles that might not come. Her mind calculated the equation in front of her: blow her cover now by directly refusing his order, or let him die to preserve an investigation that had taken 8 months to build. She resumes compressions, her voice dropping half an octave, the authority in it suddenly unmistakable despite the civilian scrubs she was wearing. "I need to see the documented consent form, doctor. No signed DNR means full code protocol. That's hospital policy." The words hung in the air like a challenge issued on open ground. Dr. Caldwell stepped closer, his presence looming over the bed like a storm cloud about to break. His voice dropped to the range that was somehow more dangerous than shouting, the voice of someone who was used to people backing down, used to hierarchy working in his favor, used to the word fear being synonymous with his name. "You're refusing a direct order, nurse." "I'm following protocol, sir. Hospital policy requires documented family consent for DNR orders. There is none in this patient's chart." The silence that followed was so thick you could operate in it. Dr. Caldwell's eyes met hers for exactly 2 seconds, the kind of stare that was meant to communicate consequences, and then he stepped back from the crash cart. He didn't stop her. He didn't call security. He didn't physically pull her away from the patient. Instead, he turned to the nurses standing frozen around the room and said, "Continue resuscitation efforts. But mark in the chart that Nurse Ross is proceeding against medical recommendation and without proper authorization." And then he walked out. The crash cart team needed no further instructions. The work resumed with renewed urgency, or perhaps with the knowledge that if this patient died, there would be no question of who was responsible or whether protocol had been followed. Danielle's hands moved through the motion she had performed in desert field hospitals where there were no crash carts, no monitors, no backup teams, only the physical act of keeping a heart beating until an evacuation helicopter could arrive. The compressions continued. 12 minutes. 15. The rhythm on the monitor began to stabilize, climbing from dangerous fibrillation into something that might be sustainable. At 16 minutes, Webb's eyes moved beneath his closed lids. His fingers twitched slightly, a sign that the oxygen reaching his brain was beginning to restore neural function. The team increased the drips, adjusted the ventilator settings, ran the labs that would tell them what kind of damage had been done and whether this body could recover from the trauma of dying. As Danielle stood at Webb's bedside, watching his chest rise and fall with the mechanical precision of the ventilator, her eyes caught something. His hand had moved slightly, fingers positioned as if holding something that was no longer there. She leaned closer, looking at his palm, and saw scarring, the distinctive pattern of shrapnel wounds, linear and precise, the kind of marks that came from a specific moment of trauma that had left identical damage in a matching hand somewhere else in the room. The same pattern as her own scars. The same marks from Marja. From 20 years ago. From the bombing that had taken a child's life and changed everything. At 0315 hours, 90 minutes after the code had started, Dr. Caldwell returned to the trauma bay with the charge nurse and a security guard standing behind him like bookends meant to prevent conversation. His face was composed now, his rage channeled into administrative action, which was somehow more dangerous than his earlier anger. Given the protocol violation that occurred during resuscitation, Dr. Caldwell announced to no one and everyone, Nurse Ross is reassigned effective immediately. No further contact with Major Webb. Security will ensure compliance. You'll be escorted to Human Resources at 0600 for a formal incident report. It wasn't a request. It was the kind of calm, bureaucratic destruction that came from someone who understood how institutions worked, how records could be weaponized, how a single decision by a senior attending could cascade through the entire hospital system and follow a person from job to job like a mark. He was already pulling out his phone as he turned away, already making calls to board members, already setting in motion the machinery that would dismantle her cover identity completely. Danielle looked down at Webb's scarred palm one more time, at the fingers that had somehow found their way to the surface even while his body was in cardiac arrest. She had held that hand once before, in the rubble of a collapsed school, when a child had placed a tarnished challenge coin into her palm and whispered, Reaper 6. Come back. And now the adult version of that child was lying on a ventilator with her cover identity minutes away from complete destruction, with an antagonist who had no idea that the nurse he'd just ordered away from his patient was the same Master Chief Petty Officer who had been inserted into his hospital 8 months ago to take him down, and that everything he'd just set in motion was about to become his own undoing. But that wasn't the worst part. The worst part was that Danielle Ross still had 16 hours to save his life before anyone discovered who she actually was. The suspension paperwork came at 0200 hours. Not verbally. Not with ceremony. A hospital administrator, Ms. Chen, Assistant Director of Nursing, appeared at the trauma bay entrance holding a manila folder and an expression that suggested she'd rather be anywhere else. Danielle was stocking supplies 3 floors away when her phone vibrated. A text from Marcus's surgical nurse, Webb crashing again. Caldwell calling it. Thought you'd want to know. Danielle didn't run. Runners drew attention. She walked, fast but controlled, down the stairwell, her combat boots making sharp contact with each metal step, the sound echoing like a countdown. 2 flights. 3. Her heart rate climbing but her breathing steady, the kind of calm that comes from having already survived the worst. When she reached Webb's floor, she could see the flat line on the monitor from 30 feet away. A straight blue line. The sound it made, that single persistent beep, was the opposite of life. Dr. Caldwell stood at the foot of the bed, his hand raised, ready to call time of death. The surgical resident was already closing his notes. Webb's chest was open, ribs spread, the cavity exposed from the earlier exploratory surgery that had revealed internal bleeding. One more complication. One more reason to give up. Danielle pushed past Dr. Caldwell without asking permission. No. Excuse me. She didn't hear him. Her hands moved on their own, muscle memory taking over. She placed both palms directly into the open chest cavity and began manual cardiac massage, her fingers compressing Wed's heart with the practiced rhythm of someone who'd done this in desert field hospitals while bullets kicked dust around her boots. 30 compressions. Steady. Precise. The heart beneath her fingers was slack, unresponsive, but she knew something Caldwell didn't, knew it in the way her hands knew exactly how much pressure a human heart could take before it broke. What the hell do you think you're doing? Security. Dr. Caldwell's voice had gone sharp, panicked. The panic of someone watching control slip away. Danielle ignored him. Her breathing matched her compressions. In through the nose. Out through the mouth. Pain was information. The burn in her forearms was information. The trembling wasn't fear. It was restraint, the restraint of someone holding back years of training, holding back the full weight of what she was capable of. Get me the experimental ECMO protocol, she said. Her voice had dropped an octave. Now. That protocol isn't approved for. He's got nothing to lose. Get it or I call the medical board myself. The surgical resident, eyes wide as a spooked horse, looked between them. Dr. Caldwell's jaw clenched so hard she could see the muscle working from 10 feet away. His face went the color of old bone. You're done, he said. Security, remove this nurse from my ER. Security hesitated at the doorway, watching Danielle's hands work inside a patient's open chest, watching her shoulders move with the controlled precision of someone who knew exactly what she was doing. They didn't move. Caldwell stormed out, his phone already in his hand, and Danielle heard him in the hallway. Jim, it's Richard Caldwell. I need you to make some calls. Yes, the board member. I've got a nurse who needs her credentials verified tonight. I want her background checked. Her nursing school contacted. Her references called. Something's wrong with her. Every word was a call to war. He was activating his network, fraternity brothers, board connections, consultants who owed him favors. The machinery of institutional power grinding to life. And every call he made brought him closer to the truth that Danielle Ross was a fabrication. That the credentials she'd built over 8 months would collapse like wet tissue the moment someone actually checked them. That her entire operation, the investigation into tampered veteran records, the surveillance of Dr. Caldwell's network, the protection of Major Marcus Webb, was minutes away from exposure. The resident whispered, I'll get the ECMO. Danielle continued compressions, sweat beading on her forehead, her breath coming in measured counts. 30 compressions. 2 rescue breaths, difficult with his chest open, but she managed it. 30 more. Her arms were already burning. Her back was already screaming. But pain was just a message from weak tissue, and her tissue had been rebuilt in places where most people would have broken. The ECMO arrived at 0217 hours, extracorporeal membrane oxygenation, a machine that would do Webb's heart's work while it had a chance to rest, to recover, to remember how to beat on its own. Danielle's hands came out as the surgical team prepped him, and she stepped back, her palms slick with his blood, her forearms shaking with the kind of exhaustion that came from moving 2,400 times in rapid succession. The resident glanced at her with something like awe. She nodded once and turned away, stripping off her bloody gloves. At 06 for 5 hours, as dawn broke gray and cold over Atlanta, hospital administration arrived with Dr. Caldwell at their flank like a prosecutor with backup. Ms. Chen held the suspension paperwork. The words were clinical, dangerous protocol violation, unauthorized procedure, exceeding scope of practice, pending investigation, credentials verification, security escort. Danielle listened to all of it without blinking. Her hands were clean now. Her scrubs were fresh. But there was still blood under her fingernails, Webb's blood, the blood of the 8-year-old she'd pulled from rubble in Marja, the child who'd grown into a major and was now lying one floor above with his heart connected to a machine because she'd refused to let him die. "I understand," she said. That was all. Not a protest. Not an argument. Not a plea. Just acknowledgement. It was the composure style of someone who'd already lost everything and survived it. Security walked her to her locker. She collected her personal items, a photograph of her unit, a book on cardiac pathology, nothing that mattered. Her badge, her ID, her temporary employee credentials all went into a plastic bag. By 0700 hours, she was walking out the main entrance into the Atlanta morning, and Cedar Creek Medical was behind her like a life she'd never had. The diner was 2 blocks away, on Peach Street, the kind of place that served coffee that had been on the burner since 6 a.m. and pie that existed in a quantum state between edible and weaponizable. It was never full. At 0312 hours on a Tuesday, or was it Wednesday now? Time had become plastic, it was empty except for a waitress named Carol with silver-streaked hair and the expression of someone who'd stopped judging people's life choices around 1987. Danielle sat in a booth with a view of the dark street outside. Her coffee had gone cold an hour ago. She wasn't drinking it. She was just holding it, using it as an excuse to occupy space, to exist in the liminal zone between one life and another. Between her fingers, she turned the tarnished challenge coin. It was small, the size of a quarter but thicker, made from shrapnel and aircraft metal from a school in Marja that had collapsed on top of 8-year-old Marcus Webb. She'd pressed her body over his in the rubble, and shrapnel meant for him had torn through her left shoulder, her ribs, her leg. He'd survived. She'd survived. And when they pulled him out, alive and screaming, he'd placed this coin in her palm with 2 small hands and said, "So you never forget." She hadn't forgotten. 20 years of not forgetting. And then Marcus had turned up unconscious in Cedar Creek Medical's trauma bay, and his medical records had been systematically altered to hide something darker than battle injuries. She'd been inserted, placed undercover as a temporary nurse, to find out who was tampering with veteran records. To find out why a decorated Special Forces major's treatment had been sabotaged. And now she was sitting in a diner at 0312 hours with cold coffee and a coin and a blown operation. The door chimed. Carol looked up. A new customer. But Danielle didn't turn around. She kept turning the coin, watching it catch the fluorescent light, watching her own hollow-eyed reflection in the dark window, a woman who looked like she'd aged 3 years in 3 days, a woman with blood still under her fingernails because no amount of scrubbing could reach some things. Her 8-month investigation was gone. Her undercover identity was compromised. Dr. Caldwell had activated every connection he had, and by now he'd contacted her fabricated nursing school in Nashville, her fake references, her false credentials. Every single one would collapse under scrutiny. By morning, maybe sooner, someone would realize that Danielle Ross, the quiet nurse who showed up 3 weeks ago, didn't exist. The mission had failed. Webb was stable, yes. His heart was beating. But she was exposed. Blown. Useless as an operative. She turned the coin again, and this time it glinted like a memory, like a promise made in rubble 20 years ago when she was someone important and he was someone small and neither of them knew the cost of keeping each other alive. The morning news anchor's voice cut through Cedar Creek Medical's morning rounds like a knife through surgical silk. We're following a developing story out of Atlanta. A decorated Master Chief Petty Officer has gone missing from an active federal investigation. Last seen at Cedar Creek Medical yesterday, authorities are expanding their search as we speak. The television mounted above the lobby admissions desk glowed with her photograph. Danielle's photograph. Her real photograph. Not the civilian nurse headshot from the hospital directory. This was her in dress uniform, medals precise as constellation points on her chest, call sign etched beneath, Reaper 6. Nurses turned. Residents stopped mid-conversation. A custodian pushing a floor buffer froze where he stood. Someone whispered, "That's her. That's the suspension." Danielle stood at the edge of the crowd, watching her own face broadcast across the hospital's main lobby, feeling the precise moment when her 8-month undercover operation stopped being classified and started being national news. The fluorescent lights hummed overhead like they were holding their breath. The lobby doors slid open. Major Marcus Webb walked through them, still connected to his portable monitor, the line trailing like a lifeline, his face still bearing the pallor of a man who shouldn't be conscious, let alone mobile. His eyes found Danielle across 30 feet of marble floor and scattered hospital staff. He straightened slightly, and though his voice emerged rough from 16 hours of unconsciousness, each word landed with military precision. Reaper 6. The Navy veteran working the security desk, a man with Vietnam tattoos on his forearms and 50 years of military bearing still etched into his spine, stood immediately. Not because he was following protocol. Because he recognized a call sign spoken with the specific respect reserved for legends. Master Chief Petty Officer on deck, the guard announced, his voice carrying through the lobby like a command. Nurses stood. Residents stood. The custodian with the floor buffer stood. The admissions clerk stood. Not because they understood what they were witnessing. Because they recognized absolute authority when it moved through a room, and it was moving now in the form of a major still hooked to medical equipment, walking toward a woman in hospital scrubs who had been suspended 24 hours earlier for the dangerous protocol violations. The lobby doors opened again. A 2-star general entered, his uniform a landscape of achievement, his presence the kind that made air pressure change. He carried a folder thick as a phone book and moved with the specific kind of calm that comes from having already survived the worst. He positioned himself beside Danielle, not in front of her, but beside her, and opened the folder. His voice filled the lobby like command radio traffic. Master Chief Petty Officer Danielle Ross. Bronze Star for Valor Under Fire, 2008, Fallujah, Jolin District. He paused. Reactions rippled through the crowd. Silver Star for Heroism in Combat, 2011, Sanjin Valley, Helmand Province. Another pause. People were reaching for phones. 2 Purple Hearts. Naval Commendation Medal. Combat Action Ribbon with 3 stars. He closed the folder slightly. And a Navy Cross for extraordinary heroism in the face of overwhelming enemy fire. Danielle's jaw remained level. Her hands did not tremble. Her eyes tracked the generals without flinching, the mask dropping in fragments, the deferential nurse dissolving, the actual rank emerging like a photograph developing in chemical solution. Marcus stepped forward, still tethered to monitors, and spoke with the clarity of a man who had waited 16 hours to say this. During the school bombing in Marja, 20 years ago, this woman shielded me with her own body. Took shrapnel meant for me. Carried me out under fire. I was 8 years old. I didn't understand what that cost her then. He looked directly at Dr. Caldwell's empty office, visible from the lobby through glass partitions. The man who tried to let me die yesterday didn't understand it either. The general's radio crackled. He spoke into it briefly, then nodded to 2 FBI agents who had positioned themselves at the lobby's rear entrance, exits covered, perimeter secure, operation contained. 1 hour later, the perp walk began in Cedar Creek Medical's parking lot. Dr. Richard Caldwell emerged from the employee exit attempting to move toward his Audi, already calculating which board members might still answer his calls. The FBI agents intercepted him with the specific kind of efficiency that indicates extensive prior planning. Dr. Richard Caldwell, you're under arrest for tampering with federal medical records, fraud, and obstruction of a federal investigation. Handcuffs. Cold metal catching sunlight. The sound like a period at the end of a sentence. As they moved him toward the vehicle, the general's voice carried across the lot, reaching staff who had gathered at the windows, reaching the morning shift preparing for their day, reaching everyone with ears and proximity. Dr. Caldwell systematically altered the medical records of Special Forces personnel. Removed critical allergies. Removed pre-existing conditions. Removed treatment contraindications. Concealed his own malpractice. 3 veterans have died as a direct result of his tampering. An FBI agent added the legal specificity while Caldwell moved between them, his Italian loafers scraping asphalt, his board connections worth nothing against federal jurisdiction. When Dr. Caldwell attempted to verify Master Chief Ross's employment credentials, his inquiries triggered federal alerts. He then forged documentation to justify her termination. Obstruction. Additional fraud. Conspiracy to commit fraud. The hospital CEO stood in the lobby doorway, watching his ER attending get loaded into an FBI vehicle with the expression of a man whose career was being rewritten in real time. Within 3 hours, his statement would be issued: full cooperation with federal investigators, unreserved apology to Master Chief Ross, comprehensive review of all medical staff credentials, zero tolerance for institutional corruption. By afternoon, Caldwell's board connections had evaporated. His fraternity brother on the hospital board resigned. The consultant who'd been brought in to review Danielle's protocol violations released a statement calling her cardiac massage a textbook emergency intervention that preserved life against impossible odds. The charge nurse who'd enforced Caldwell's orders requested immediate transfer to another facility. At the FBI vehicle, Caldwell turned back toward the hospital one final time, searching the crowd beyond the glass, perhaps hoping for allies, perhaps hoping for sympathy. He found neither. Marcus Webb stood in the lobby, still connected to his portable monitor, watching the arrest with the quiet satisfaction of a man who had survived what was meant to kill him. He looked at Danielle across the dispersing crowd, and in that look passed 20 years of debt and 20 hours of vigil and the specific bond that exists between two people who have saved each other's lives. "You saved me twice," Marcus said simply. Danielle shook her head, her voice dropping an octave lower than the deferential whisper of 3 days ago. When she spoke now, she spoke with the authority of someone who had command of situations that mattered. "You survived twice. I just bought you time." The general approached her, his medals catching the same Atlanta sunlight that caught everything in this hospital. "Your cover's blown, but the mission succeeded. We've got evidence on 6 other providers in 4 states. Webb's records were the key. You cracked the entire operation." Danielle nodded, still processing, still half expecting the other shoe to drop, still waiting for the part where she'd been wrong about something critical. But there was no shoe. There was only the lobby of Cedar Creek Medical in Atlanta, and her photograph no longer on the news. 6 months later. Danielle Ross stood in Cedar Creek Medical's executive wing, her hand extended to accept a position that had not existed 48 hours prior, Director of Veteran Services. The hospital board had created it specifically, with authority over all veteran patient care protocols, all medical record audits, all hiring decisions for providers who would serve Special Forces personnel. Compensation at the level of department chair. Oversight committee reporting directly to the hospital president. The apology from the board had been formal, public, and financial. A settlement that would have made Caldwell's $200 bet feel like pocket change. Behind her desk, mounted in a frame with museum-quality lighting, sat the Marja Challenge coin. The same tarnished piece of metal that had turned between her fingers at 3 in the morning when she thought her operation was over. The same coin that the child Marcus had pressed into her palm in the rubble 20 years ago, pressed into her palm again by the unconscious Major's belongings. It caught the Atlanta sunlight streaming through the corner windows of her new office. Someone would later report spotting Dr. Richard Caldwell at a community college outside the city, teaching CPR fundamentals to a group of students who would never know he had once controlled an entire emergency department through fear. He was teaching basic chest compressions to people who might one day save a life without ever understanding the cost of that knowledge. Minimum wage. No benefits. His medical license permanently revoked. His name appearing on federal watch lists. His board connections dissolved like morning fog. Marcus Webb, fully recovered from his cardiac event, accepted new orders with the specific kind of relief that comes from survival against overwhelming odds. He was assigned to train Special Forces medics, teaching them techniques that Danielle had refined in field hospitals across 3 continents, teaching them that the mission is always the person in front of you, that rank means nothing when someone's heart has stopped, that the ones with the most combat experience should be the ones treating the wounded. At the dedication ceremony for the newly opened Veteran Services Wing, Marcus stood beside Danielle as the general pinned a Navy Commendation Medal on her uniform. She was in dress uniform now, her rank insignia visible, her call sign no longer hidden in fabricated nursing files. A reporter asked what had sustained her through 16 hours of direct cardiac massage, through suspension and investigation and the collapse of her cover. Danielle's hand touched the challenge coin in her pocket, and she looked at Marcus, the child she had saved, the man she had saved again, the mission that had cost her cover but succeeded anyway. "The ones who have seen the worst often give the most," she said simply. The crowd applauded. Webb saluted. And Master Chief Petty Officer Danielle Ross, no longer undercover, no longer hiding who she was, saluted back. Thank you for watching. Please subscribe to our channel, like this video, and comment below with your thoughts. What would you have done in Danielle's position?